This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
You know, diabetes is a very complicated disease. Perhaps your parents told you that if you ate too much sugar, you would get it. Well, we know that's not necessarily true, especially for those who have type 1 diabetes. Then there's the devastating toll it can take on different parts of your body. Well, today we're focusing on diabetes and your eyes. And to help us do that is Dr. Catherine Smoot-Haselnus, a board-certified ophthalmologist with Chesapeake Eye Center. Thank you so much for being here. So November is National Diabetes Awareness Month. So why do you think it's important that we be aware of diabetes?
Well, diabetes, as you already said, takes a toll on your body. Diabetes affects the small blood vessels of your body and takes them from being like garden hoses to being more like sprinkler hoses, where they can leak throughout your body. That can be, you know, your heart, your nervous system, your extremities, but certainly your eye, where you have a lot of small blood vessels. So when those blood vessels start leaking in your eye, they deliver the plasmas or proteins that are in your bloodstream and can cause swelling in your central vision, which can lead to a lot of decrease in vision. In the later stages, that's early diabetic retinopathy with macular edema, in later stages that can be so severe that your retina doesn't get enough oxygen, so you build abnormal blood vessels, and they're really frail and tiny, and they can bleed easily, so you can get bleeding inside your eye called vitreous hemorrhage. And if it gets really bad, you can get scar tissue that actually causes that retina to even detach at times in very severe cases. So visual loss is a leading complication of diabetes in young people. So
really?
It really is.
This is something that, you know, once you get to that point, there's no coming back.
When you get to that point, you're looking at a lot of surgeries and your vision's threatening. Is what we try to do is encourage diabetics to have a yearly eye exam, and we detect those findings early. And if we detect those findings early, hopefully by intervening with appropriate measures, we can prevent this severe visual loss of diabetes. And over the course of my years, with more awareness of diabetes, I am seeing less visual loss than I saw in my early days of my practice. I will say that it's incumbent upon every individual to manage their diabetes, because we have seen if the early stages of the diabetic retinopathy, with better control of your sugars, you may have an initial worsening of the eye changes, but in the long run, there's less likely to have visual loss, and it may even regress to where you're not in danger.
All right, so that means that they really have to take control of what they eat, everything.
You have to own this disease. Because if you do not own this disease, it will own you. I tell all my patients, if it's white, it's not right. You know, avoid the carbohydrates, the rices, the potatoes, the breads, by God, the sugars, you know, and the sodas. People aren't aware of some of the things they're doing that can make a huge difference. Keeping your weight down, exercising regularly. Certainly not smoking, because smoking affects blood vessels, where the diabetes affecting blood vessels, you're a target for a disaster. All these little things you can do that make a difference. Follow your primary care physician's instructions. Take your medications if you're on them. You know, all these things, try and be proactive and manage it. A lot of educational materials in the American Diabetes Association. There are nutritionists associated with the hospitals, and with many of the pharmacies you can get information, your primary care physicians.
So it's not a matter of just taking your insulin and everything should be okay.
No, it's not like if I eat this little pill or take this insulin, I go have that half-gallon ice cream. No, it doesn't work that way. You have to be responsible for the front-end preventative measures of controlling this disease. And then hopefully these other tools we have at our disposal can help push you over the edge of good management.
So if you do have diabetes, you need to get your eyes checked. That's the bottom line.
Every year, without a doubt. And if you start having changes, it may be every 6 months. And if they're more advanced changes, it may be every 3 months, or you may be involved with one of our retina specialists in town.
All right. Well, thank you so much, Dr. Catherine Smoot-Haselnus. Thank you.
Thank you.